Hello and welcome to Profiles in Risk. This is your host, Tony Cañas. Very tired today, but I'm here. And you will notice that I am recording from an Airbnb, so I apologize for my background. It's a little messy. I am here in Miami for Insure Connect. We're recording on a Sunday night to get this out quickly. So I want to really thank my guest today, Clay Olsen, who is the founder and CEO at Impact Suite. So Clay, first of all, thank you for agreeing to join me Sunday night so that we could get this episode recorded as quickly as possible. How are you
Oh,
today?
thanks for having me. Doing well, yeah, doing well. It's not as late for me as it is for you in Miami, but yeah, glad to be here with you.
Awesome, awesome. So today is a special episode, basically. Most episodes are interviews with InsurTech founders. In this case, the reason we're doing this episode is because there's an exciting new partnership between Insure Equality. And for the listeners, if you haven't heard of Insure Equality, I talk about it all the time, but go to insureequality.org. So Insure Equality is partnering with Impact Suite in order to bring a really cool benefit uh, into uh, into the insurance agency space where this was not easily available before. So Clay, what is Impact Suite?
Well, Impact Suite is we are a mental wellness company that combines preventative technology with professional human care. We want to meet individuals where they are. I think that typically when you think of mental health or behavioral health solutions, you think of kind of offering services that are addressing the the crisis situations or kind of the situations that have bubbled up into a level of serious concern that requires professional intervention. And
Mm-hmm.
although of course we do offer services that do just that, we also want to get at the root contributors and help be more preventative in nature. And so we do that through a number of different ways. Through technology, through self-guided resources, through identifying risk factors for individuals to help them, start on a journey of self-discovery. But we want to be, rather than just the ambulance at the bottom of the mountain, we want to be at the fence at the top of the hill as well. So, we really look at ourselves as a comprehensive mental health partner to really kind of meet the employees or meet the individuals or members where they're at and help them on a journey of self-discovery of self-improvement.
Okay. Okay. So wellness has become a huge deal in the last few years, but in my experience, the wellness benefits that I've had at different employers have generally been just kind of like measure my BMI and like get my blood tested once a year kind of thing, right? Very physical type benefits. And then some employers have given me access to like a couple of like counseling sessions a year kind of thing, but certainly nothing uh, nothing more holistic than that. And I've only had those at big employers, not when I worked at smaller employers like a lot of our listeners at insurance agencies. And demographically, uh, Gen Zers especially, uh, mental health and access to good mental health care is absolutely crucial for that generation. They're deeply aware that of how important it is. So it sounds like something super cool, and it sounds like something that would be very hard to offer outside of like large group policies.
No, yeah. Typically, the types of services, the comprehensive nature of what we offer, typically has been offered to only large organizations. Small organizations just could not, it was not an accessible resource. And that we have really focused on being able to provide. Yes, we do have large employers, but we have a lot of mid-sized and even small organizations that are utilizing our resources because this is not something that is a cherry on top anymore. Mental health resources, just like you're suggesting, according to recent data, 81% of Gen Zers are demanding it as part of their compensation package. There's been a huge tectonic shift in expectations with regard to the mental health services. It helps with recruiting. It helps with retention. It helps. with productivity and just an output as a general sense for the company. This is no longer a luxury, it's a necessity for most employees, and they go looking for this as a part of their hunt, for their job hunt.
Uh,
And so, yeah, we wanted to make it incredibly accessible. And we really, there's a dominant message or narrative around mental health
okay.
that is somewhat depressing. The story we tell about depression is often depressing, in that we say that if you are diagnosed with depression, that this is a lifelong sentence for you, that this is something that you lost the genetic lottery, and you're just going to have to kind of manage and cope, and let's do our best to do that. And that for so many people is just too much to handle. It was for my niece, and that's why I started Impact Suite, and so many others in my life that just could not take that kind of narrative. And the truth is that there's just a mountain of literature and research suggesting just the opposite, that these don't have to be life sentences, that we can overcome and conquer a lot of these challenges that we face in our lives, and that there's small iterative adjustments in key lifestyle areas can have not just linear but catalytic improvements and compounding improvements in our well-being. And we've helped hundreds of thousands of individuals around the world do just that. And the literature, that the research and our own data validate the same message, that this is very possible. Let's get at the root contributors and help you navigate that through professional human intervention, lifestyle coaching to help you navigate some of the those key areas that we've identified, through self-guided curriculum and content and challenges and goal setting, all of the above. We're very committed and passionate about helping people find that well-being.
I absolutely love your passion for it, without question. Okay, so if I understand it correctly, basically, um, through this more holistic and more innovative delivery system, uh, uh, basically it make it makes it much more likely for people who struggle with mental health issues to stay on the good side of without falling into the point where they need uh, crisis help.
Yeah. It really comes down to, if we can help individuals, one author refers to it as the upward spiral. If we can help instead of the downward spiral that we all find ourselves often in, if we can help people make small adjustments and start to see that small improvement. By the way, we visualize those and help you visually track your improvements over time, so you can see, just like a mental health Fitbit or a mental health Apple Fitness for your mental health. Like, we help you visualize those improvements, those incremental improvements, to really spark an upward spiral for individuals. And we see our utilization is 10 times that of a traditional EAP or employee assistance program, because of the ease of access and the comprehensive nature of what we offer. It is so much more easily accessible and easy to engage and kind of get going on the gamified experience of it.
That makes so much sense to me. Um, when I've looked at employee assistance programs in the past, they're kind of hidden in the company's intranet, and then they need to be accessed by phone, like only during business hours, or there might be a 24-hour line, but basically like just not delivered in a way that is super helpful when you really need it. So looking at the website, I love the fact that this is literally delivered via an app on
Yeah.
that's on my iPhone at all times, right?
We don't want you to have to remember a phone number or have to go reach out to HR. We don't want to have any of those typical barriers that but quite frankly, those traditional EAPs count on. They count on those barriers because they anticipate low utilization, because that's how they kind of make their business model centers around you,
Yeah.
very low utilization. And let's be frank, EAPs have got a bad name for them because they have traditionally underperformed and been underutilized. And so we don't even consider ourselves an EAP because of that bad rap. We consider ourselves a mental wellness company and just a holistic wellness company. And we really we really come at it from a completely different approach, and it's kind of this new age approach to addressing these issues that most companies are recognizing that this is necessary.
Okay. Okay. Awesome. So you guys have been doing this for a while. Looks like you've been at the company for about 6 years. What kind of results are the numbers saying you're getting?
Yeah, I'm glad. Yeah, so on average, when it comes to depression and anxiety, we had a third party analysis done by the University of Alberta and Utah State University combined to do an assessment of our data from the users, and what they found was a few things. One is, on average, individuals are decreasing their symptoms for depression and anxiety by about 25%. Now that's on average. That's taking all users on the aggregate. Highly engaged users, we're seeing closer to an 82% reduction in their depression and anxiety symptoms. And if you look at compulsive behaviors or addictive behaviors, we saw a similar trend. We saw about a 24% reduction on average in symptoms for addiction, and about an 86% reduction on the highly engaged users. So overall, we're seeing incredible results that are literally life changing. I mean, if you think about improving depression and anxiety symptoms by a 25% increment, that literally can be life saving for many individuals. And to think that you could actually, on highly engaged users, on average, are seeing an 85% reduction, or in the 80s, right? That's ridiculous, because that means that some users are seeing zero symptoms, that they have gone past any level of diagnosable depression identification, which is astounding and incredibly hopeful for individuals that are suffering from this, that have tried so many things. So we're seeing really good things. Not only that, though, I think this is an important thing for your listeners to hear. In addition to all that, we also saw that over 90% of individuals felt like that they had all the tools to be able to reach long-lasting healing. And then, in addition to this, for the CFOs that might be listening, or those that are in charge of accounting, we found that according to the data, looking at medical spend, looking at productivity, looking at turnover, looking at absenteeism, what we found is that for every dollar spent on our intervention resulted in a $5.86 return on investment, when all those things were accounted for. So again, according to this third-party analysis, this university analysis, we were very pleased to see the kind of results that we were seeing.
That is fantastic. And the I don't know what to call it, the program, the partnership with Insure Equality basically means that listeners, if you run an insurance agency or an insurance organization of some sort, signing up through Insure Equality, if I'm not mistaken, the pricing currently is $7.50 per employee. Did I get that correct?
Yeah, I'm actually not sure what we landed on, but I think that what we can guarantee, and again, the partnership, because it might have variations to it depending on what the audience might be demanding or needing for their company, because that can be variable. But nonetheless, what we can assure is that through the partnership, we can give discounted pricing that you wouldn't be able to get otherwise.
Perfect. Yes, it's something on the lines. When I don't have the number in front of me, but I was, when it was first shared to the board of Insure Equality, I was fantastically impressed, because this is the kind of thing that's not easily available to small employers. We have literally 30,000 small agencies, or 30,000 agencies in the U.S.
Yeah.
that do insurance, and they have a hard time attracting and retaining talent, especially young talent. And this is exactly the kind of benefit that can make a huge difference in helping them attract and retain talent. And the results that you're getting are absolutely amazing
Yeah.
for a very affordable cost. And I love that you've had independent research on how much benefits comes for the expense. Uh,
Yeah.
Absolutely fantastic. I've got a family member who's been going through significant depression and to the point that they had to take a month of FMLA and go into intensive outpatient therapy. And it is so hard to see them go through it. It's so hard for the person, so hard for the family. It's like so hard for everybody involved. If that kind of getting to the point of being debilitated for a month, if we can avoid it through this kind of daily, more holistic pre-treatment, that's a huge win for society in general.
And anonymous, right? So many individuals don't get the help that they need because they either don't know where to find it, or they don't know how to access it, or they fear that they would have to notify an individual that would then, lessen their chances at advancement within the company, or some stigma that is just
Mm-hmm.
stopping them from accessing that. So we wanted to kind of lower, get rid of all those challenges, make it completely anonymous, so that their employer, we provide aggregated reporting back to the employer,
Okay.
which allows them to kind of see trends on the whole, but no user identifiable information is available. And so, for employers that have a minimum level of, they have to at least have a certain amount of employees, because otherwise, if it's 3 people, then we're not going to provide any
Yeah.
reporting other than that it is being utilized, but
Mm-hmm.
nothing that would possibly identify the individual. But for companies that are they're just slightly larger, we can provide reporting that is very helpful, because they can then say, "Oh my goodness, it looks like of all the lifestyle categories that we're measuring here, it looks like financial wellness is one of the areas of concern, or that our employees are struggling with, or sleep, or stress, or meaning and purpose." And these are the actionable items that the employer can then say, okay, well, why don't we do something, or why don't we plan an activity, or why don't we invite that guest speaker in, or things that can really help address some of those key areas that are on the whole, on the aggregate, plaguing or challenging their employee set. And we provide deep uh, leveled reporting that isn't just utilization, which would be typical, like, hey, this many sessions or whatever. We want to provide, hey, within depression or anxiety, you've seen a 25% increase or decrease or improvement on these areas: sleep and exercise and meaning and purpose and past trauma and relationships, and all these things that we're actually able to provide kind of an ROI on the whole. And it's really helpful for employers to be just like, oh my goodness, this is so actionable, and this is such a reveal that I could not possibly have gotten this information any other way.
Love that. Absolutely love that the report back not only lets you know that it's being used while protecting the privacy, but also helps you figure out what could be improved.
Yeah.
That's fantastic. Clay, thank you very much for your time. This is fantastic work that you guys are doing. I'm so excited that we have this partnership, and it thank you for what you guys are doing.
Yeah, thank you. I appreciate it. And if we can help anybody that's listening, we'd love to see how we can help, and become your internal partner on this journey.
Thank you.
Okay.